Hello, and welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Herodopoulos, and today we're discussing skyrocketing healthcare costs and what the American Board of Internal Medicine Foundation is doing about it. Earlier this month, they released the Choosing Wisely campaign. It's an unprecedented multi-year initiative that aims to reduce the unnecessary medicine and increase dialogue between patients and physicians. 9 physician specialty organizations have identified 5 tests and procedures in their respective fields that may be unnecessary or overused. Today we have with us Dr. Craig Deligdish, who's a local oncologist and a member of the American Society of Clinical Oncology, which is one of the 9 groups that have been commissioned to help on this campaign. Welcome, Dr. Deligdish.
Thank you very much. It's a pleasure.
So, the group, American Society of Clinical Oncology, came up with 5 areas. Can you speak about these areas that have been thought of as being unnecessary to increasing healthcare costs?
Sure. I think, to start out with, the cost of cancer treatment has, as you said, like many other forms of care, skyrocketed over the last decade. And today is projected to cost $100 billion in the United States alone, and as much as $200 billion 10 years from now. So when asked by the American Board of Internal Medicine, the American Society of Clinical Oncology chose 5 areas. 3 of them are actually very similar. So they looked at both diagnosis and treatment. And in the area of treatment, the American Society of Clinical Oncology basically said what we already know, which is that we should not treat patients at the end of life or provide treatments to patients where there's a very low likelihood of those treatments being effective. And the other major area that was chosen was an area of both diagnosis and follow-up. Today we have available to us complex diagnostic studies, PET scans, MRIs, and blood tests. And we know that in early stage disease, those tests generally are going to be normal. And so ordering them is something that we believe to be, is not necessary and contributes unnecessarily to the high cost of care.
You had mentioned that less than 1% of early stagers were going to be positive on PET scans and bone scans and images and biomarkers for metastases. Can you speak to that?
Sure. In patients that are diagnosed with early stage disease, stage 1, breast cancer, prostate cancer, we know that based on studies that have been done over the last decade, that the likelihood of those any sort of diagnostic study being positive is less than 1%. And because of that, it's just simply not necessary. It is not going to change what we do in the majority of cases. And so that's the reason that we don't believe that those studies contribute significantly to altering the treatment or the diagnosis of patients with early stage cancer.
Well, thank you for being with us today, and we appreciate your input. The Choosing Wisely campaign is a great start in working to change the trajectory in which healthcare costs in our country are headed. To view the list that the 9 physician groups have provided to the campaign, log on to www.choosingwisely.org. And for more information on this topic and other health news, check out Your Health with Dr. Stephanie, which appears every Thursday in Florida Today's Health section, or visit floridatoday.com.